Well, good afternoon, and welcome to our session on regulating the future of care. This is session Atom 12, so if you have questions as the conversation proceeds, please enter them on the Atom 12 Slido, and we'll be able to consider them, I hope, with time at the very end. This is a session that's going to concentrate on regulation in AI and digital health. Our two panelists come at this question from deep experience and with different perspectives. And I'd like to begin, if I may, Youngjin, with asking you a question.
Sure.
Because your experience in business management has taken you into many different areas of endeavor, including health, but certainly in many other areas. When it comes to digital and AI technology, what, if anything, is special or different about the health sector or health industry compared to others where you would be working?
Thank you for the question. For the work that I do, I am interested in the use of technology and how it creates value and how it changes the way we organize our work. That's what I'm interested in. And one of the things that the current project I'm working on is how we can create technology and organization that creates what I call endogenous utility, meaning that there is an increasing return on utility from the technology instead of decreasing return of utility. That type of argument and principle can be applied in any fields. I think what is unique about healthcare, there are a few different ones. One is that the misalignment between the value creation and those who are paying for is one big challenge. In most places, those who get the benefit are the ones who's paying, and so the flow of value creation and value capture and payment is pretty well defined. Particularly in the United States, it's very, very complicated. In other countries where it is more public health, similar problem, slightly different sort of flow of money. So I think that is one area. The other one is that in healthcare, the potential of getting a very personalized, we heard throughout the day, the benefit is real, unlike others. The opportunity of creating this increasing marginal utility is real and substantial and consequential. So I believe healthcare could actually be where the canary of all digital innovation in general, because this could be a laboratory where we can try out things that we haven't been able to do elsewhere.
Very interesting. I hope we come back especially to your first point about the misalignment between incentives and benefits for healthcare and perhaps the connection to digital technology.
Sure.
But Suwit, let me ask you a question, because you have been engaged with healthcare, preventive health, public health for an entire career. You've seen many different kinds of technology enter into, be absorbed and utilized in health. We've heard about some of them in the course of the day. So my question to you is, what, if anything, is distinct or different about digital technology and AI compared to other technologies that would be incorporated in health?
Harvey, very good question. Any technology for me will be good for healthcare system when they can answer two questions. How can they make the 4.5 billion people in the world who have no access to essential health services have the access? How can they prevent 2 billion people of the world who face catastrophic health expenditure not to face it? If they can do that, they are good technology for the whole, for the all. If they cannot, they may be good technology for the few. I'm a public health man, global health people. My interest is global and public, not private interest. And AI, for me, can partially answer that. I just visited a rural hospital on a remote island with 3 doctors there, all GP, no specialist. When I went there, I saw them screen patients for tuberculosis. Patients online, waiting in line for that. And the doctor can read the chest X-ray film very fast because the AI helped them. They're GP, they're not radiologists. So if AI didn't spot any abnormality, they can, conclude easily, which means that AI helps these people in the remote island to have access to the equality of a radiologist.
Suwit, let me extend this just a bit because you're pointing out the ways in which digital technology, telemedicine perhaps, and AI interpretation can extend the reach and, if you will, increase health equity by access and by expertise reaching places it could not reach. But some people also worry that these technologies will increase the gap between those who have and those who do not have, because they will not be applied as readily and as fully to those most in need. So when you look at this picture of AI, digital technology, do you see it mainly as a plus for extending public health and equity, or do you see it as potentially mainly benefiting those who already have many advantages of education, high technology, willingness to learn for themselves, and so on? How do you balance those two?
Actually, they are both. Let me give you an example. In Thailand, if you are an informal labor, you live on day-to-day work. You earn maybe $10 a day for your living. If you don't work, you get nothing. Then you suddenly get sick, not serious illness, and you have to go to the hospital in long line and spend whole day there. You lose $10. Now we have an application. You click the application. You talk to the doctor immediately. Talk to the doctor live. And within some minutes, the doctor diagnoses you through verbal symptom base and send medicine to your house. You don't have even to leave your house, all paid by our universal health coverage. This is a benefit. Of course, better off people like me can do the same. So they both benefit.
So it will raise all, regardless of whether those who benefit are already advantaged,
Right.
But it helps especially those who are
It's
disadvantaged.
very difficult to focus only the poor.
Yeah,
The means test always fail.
yes. Thank you. Let me turn back, Youngjin, to you, because I want to focus now on the regulatory requirement, need, or danger. Some people focus especially on the advantages of AI and digital technology, and they worry that regulation will inhibit, constrain, or limit the ability of these technologies to serve their purpose. Other people are very focused on the dangers, on the loss of privacy, on possible errors, on loss of responsibility. And they say, no, we need to be careful, we need to regulate. How do you think about this balance of technologic advantage and regulatory needs as you think about AI and digital health?
I'd like to add one more variable there, that is market force.
Okay.
And so when you combine the technology and the market force, and then think about regulation, what role should we play? And I think regulation should be coming in only when those two things cannot address the problems that we have. And technology is constantly innovating. And we can, for example, do things that we thought we could not do in the past. So you mentioned the data ownership and privacy and so on and so forth. In today's technology, actually, that is not a problem anymore. You could actually keep your data and actually enrich the data that hospitals will never have. And then you could actually run your model privately and then the model builders can actually gain access to data, not only to infer, but also to train the model at the same time. And they can also secure the intellectual property of the model so that you could actually accomplish what used to be conflicting goals. So the problem of regulating all the details is that the technology constantly changes, and the regulation will never be able to offer those things. So I think one of the principles is that the regulation should be done at the very minimum level as much as possible. Two, I think regulation should be not only looking at privacies, which is very important, safety, but also thinking about creating an economic ecosystem so that it can grow, and then that the economic growth can put the capital back into the system so that new technologies can be developed and new data can be collected. And I think it is an incredibly important opportunity for us to rethink the role of regulation when it comes to digital technology. It's very powerful, therefore it is also very dangerous, but I think we overplay the risk of AI and data and technology in many cases.
You very interestingly emphasize the capacity of the technology itself and the way it's used to dissolve some of the regulatory concerns, like this question of ownership and control and privacy. And I think this is a very important area that's not well understood in the public at large, much less among our political leaders.
Right.
And it's an area where a lot of education, I think, is going to be needed. Do you agree with that?
I absolutely agree. And then also, I think there are areas where actually we need more thoughtful regulation needs to be done, is not being done very effectively. Let me give you an example. As a result of data and datafication, the relationship between knowledge and data, I'm talking about very esoteric sort of academic conversation, but the data and knowledge, the relationship between the two are being reversed. What I mean by that is that in the past, knowledge used to be the one that generates data, and then the knowledge is sanctioned by the institution. So for example, in medicine, you can exercise institutionalized knowledge as licensed physician. Every data that you generate comes from the knowledge. Now, what the technology is trying to do is that now you can measure blood pressure without going to the doctor, without using FDA-approved devices. What does that mean? Now the data is generating knowledge, not the other way around. And this is a very, very important problem that we need to actually think about. What is the implications? What is the whole education system, licensing system? So, and no one actually is talking about it, how we actually think about it. So I think these are some of the sort of blind spots that I see in regulation. And on the other hand, we are over-regulating parts where we probably are doing too much of regulation.
Perhaps paradoxically, wise regulation can liberate the participants to act in a way that they have confidence they will be able to succeed.
Right.
And that's another dimension. Suwit, as you think about the regulatory requirements for effective, safe, and appropriate use of these technologies, what concerns, if any, do you have where regulatory authorities should focus?
Harvey, do you know that I used to work as the Planning and Technical Division Director of the Thai FDA for 3 years?
Does this mean you know too much about this problem?
I know too much about the agency, yeah. The key issue is the trust-based good governance system, not just the regulation. Regulation is just part of the good governance. You talk about data. Do you have a system that people trust the system to be able to want to share their data? If not, you cannot have AI. You don't have big data. So trust-based governance system is the most essential one, which include, of course, the regulation. And Dean Yap saying, you should be proud of Singapore in the ASEAN region. When the first AI chest X-ray developed based on big data from Thailand, big film chest data from Thailand, the developer tried to register it with the Thai FDA. They have so many questions because they don't know how to do it. So that developer went to Singapore and got the approval from Mimi, the former CEO, very quick. And Raymond confirmed that, your current CEO. And when they get the registration, the license from Singapore, they submit it to the Thai FDA and got approval very easily. Governance includes capacity. Developing countries usually do not have enough capacity. Regulators usually do not have enough capacity. So they sit in their room, in their office, waiting for the developer to come and please, we are submitting you the market authorization dossier. Please consider us. And they'll come back with so many questions because they are not confident in what they are going to approve. This is the problem.
A special challenge for many regulators are new technologies which are not exactly in a class that they're accustomed to. It's not really just a drug. It's not simply a device. It is an information collection, reporting, maybe even intervention system all rolled into one. And this is a huge challenge for regulators everywhere. Suwit, is there a way forward other than doing the best we can with each new technology to absorb it and to learn and to understand how it can be best approved and made safe?
Government policy will change it. Now our Thai FDA moved from a regulator, passive regulator, to be an active regulator. They reach out to innovator. They reach out to innovator to help support them since the development process. Actively reach out because the government instructed them that this is what we want you to change. Don't sit there in your office and do your usual job. And once you have all these regulations, in developing country, it's invite corruption. Delay. When you put in some money or some incentives, the delay reduce. That's not good. That's not good for the economic growth. That's bad. And if you look at the corruption index in my country, it continues to drop.
Well, we try to avoid that. But for today, let me just come back to you, Youngjin, and I want to ask if you could, in just a few seconds, summarize for you what is the one message you would want today's leaders to understand about regulation, AI, and digital technology. What one message would you give them?
I think the digital technology, what is different with other technology is that it creates value at the moment of computation, runtime. And if you do not actually understand that, you are going to regulate wrong thing, wrong place. Data ownership does not create value unless the data is used by algorithm to perform the computation. And yet, no one is regulating computation, where computation is being done, except they all focus on data ownership. Wrong problem.
Thank you so much. Suwit, you've made such an important point about the value of this for extending technology to places and people who otherwise won't get it, and emphasizing the role from a business point of view of aligning the incentives with the values that we achieve. I think these are very important and useful messages to carry with us on AI, digital technology, and the role of regulation. Thank you both very, very much. Thank you all.
Thank you.